Hello, everyone. My name is Dr. Jacobs. I'm a doctor of physical therapy, and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor, and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty. So, Eddie, tell me what's going on with your jaw. What's happening?
It clicks when I open and close it. I just, clicks this joint right here clicks, and I'm grinding my teeth.
How long has this been going on?
Oh, probably 8 or 9 years, maybe.
8 or 9
But
years.
it's only really gotten bad the last couple months.
Couple of months.
Mm-hmm.
Did you have any treatment for that?
No.
Okay, so can you explain to me what kind of symptoms you have because of this clicking?
I get headaches and teeth grinding.
So how long you been experiencing the headaches?
3 months.
3 months.
Mm-hmm.
And how much headaches from 0 to 10, and where do you feel the headaches?
Normally about 3 to 4, and the headaches will be kind of behind my eyes to the back of my head, back here.
Is that
and right at the jaw, like right in here also.
what time of the day? Is it constant or it comes and goes?
Pretty constant.
Constant. Okay. So you said, like, when is the worst headache? Is it in the morning, later, morning? Do you have any other symptoms than that?
No.
Any fullness in the ear, ringing?
Oh, the
anything
ear
like
ringing, yes.
Okay. Can you explain to me? Do you clench, grind?
During the day, I'll just kind of have my jaw together,
Okay.
not like this, but I don't really grind it.
Okay.
At nighttime, I wear a mouth guard and I grind at night.
You grind your teeth
Yeah.
at night. Okay. So everything we do should not aggravate your symptoms. So currently you feel headache right in here, yeah?
Mm-hmm.
Okay. And how much is now the headache?
Right now, about 3 to 4.
3 or 4. Okay. Okay. So you feel it right in here?
Yeah.
Okay. Have you had any head trauma or accidents?
No.
So the problem that you clench at night or grinding, that would start your headache.
Yeah.
Mm-hmm. So, and you said you grind your teeth like start worn out now.
Yeah.
Mm-hmm. Okay. And the ringing. Excuse me. Where do you have it? Both ears or one ear?
Both ears.
Okay. Feel any pain with that?
No.
Okay. Any trouble opening your jaw?
No.
Okay. Okay. You feel those bumps here?
Yeah.
That's a scar tissue.
Oh, really?
Yeah. So when you clench at night or grind your teeth, let's say like you did that for 5 hours.
Uh-huh.
So it's similar like you are in the gym doing one single exercise for 5 hours.
Mm-hmm.
So you're gonna have a micro tear in the muscle,
Oh, okay. Hmm.
and then the body has to build the scar tissue. It's part of healing. So that's why it's common with TMG to have those grinding like that scar tissue around the temporal area here. And our muscle should act like a rubber band. When it contracts and relaxes, it does this.
Uh-huh.
When you have a scar tissue, it's like you have a knot in the rubber band. So when your
Mm.
muscle contracts, does not stretch.
Okay.
So you clench or grind at night. So this muscle is start to get tight, start to compress on your nerve and artery, and could cause headache symptoms.
Hmm.
That's why you feel that. Scar tissue here. And it's common with TMJ, jaw pain, that patient have tension headache. And usually a lot of patients can feel it more in the morning when they wake up from clenching a lot at night. Is that too much?
No.
But you you did not have a head trauma, did you?
No.
Okay. Do you feel pressure behind your eyes? Or just
Sometimes that might be. I have some just allergies when the weather changes and stuff.
But this headache is.
But yeah, but with the headaches, it's normally behind the eyes.
Okay, so tell me, can you feel any different now? Different headache, or it's gone?
Yeah, it feels better.
Zero
Yeah,
to,
mention it. Yeah,
0
yeah,
to 10 now?
yeah. Maybe a 0 to 1. I feel a little bit, but
Where do you
not
feel
much
it?
at all. Just kind back in here. Maybe towards the top more, just because maybe because the sides not bothering me anymore.
Okay, you start to feel the tightness in the top, but it's not too bad. Can you tell like where the scar tissue more? It's not
No.
too bad here actually. Here, it's around your temporalis that's attached right from here.
Really?
It's like the shape of temporalis. It's like half butterfly wings,
Huh?
like this.
Now, will that ever go away? Can you make scar tissue go away?
Yeah, we can
Okay.
get a like help to break down the scar tissue.
Okay.
As long as you don't clinch again,
Mhm.
you're not gonna build a new scar tissue. So I'm gonna go over with you after the video
Okay.
what we can do to prevent and decrease the clinching. So will be no reason for building a new scar tissue.
Right. Yeah.
And you will notice when I'm working on it that the thickness and the bump
Mhm.
feeling on the scar tissue start to decrease. I'm just shaving it.
Huh. Okay.
Sorry, I messed up your hair.
Oh, that's all right. That's
Yeah, it's too late
I don't
to
even
ask,
comb it
actually.
anymore. Yeah, I just kind of shake it out. I just got it cut really short. I don't worry about
Yeah,
it.
you do the same thing like me? Just
Yeah. It's,
wash my hair and
yeah. Move on with it. Yeah.
throw it away in the tub. Just make sure to cover the little bald I have.
Yeah, that's right. You keep
That's
as
what
much
I
as you
try to
can
do.
just so you don't get sunburned.
Yeah, yeah.
So I'm so fair complected. Yeah, because getting
Yeah,
sunburned is a
that's,
problem.
yeah, it's easy. So you said your headache been constant for how long now?
Oh, I've probably the last 3 months. It's been the worst, but it kind of comes and goes. I can my whole life I remember.
Yeah,
But it's just kind of a dull pain. It's not anything that
yeah.
stops me from doing anything.
But it's been nagging for the
Yeah.
last 3 months.
Yeah.
Okay. All right. So tell me, how do you feel now from 0 to 10?
Yeah, more like a 0. It
0.
feels a lot better.
Okay. Any other symptoms or everything is okay?
No, I just feel my teeth kind of in the back are sore.
From clenching.
Yeah, yeah.
We're gonna work on decreasing the clenching so you don't feel soreness in the teeth from a lot of clenching. So
Mhm.
yeah.
Yeah, but the headache feels a lot better. Yeah, it feels
Okay.
good.
Awesome. So what do you think about ASTR treatment?
Yeah, well, so far it's worked.
All right.
Yeah, definitely the headache going away is nice. And
Okay.
it's easier to concentrate at work.
That's awesome. Thank you so much. Thank you.
Sure.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.